we're going to go ahead and actively help him. So it's called ART, active release technique, meaning he is actively helping me to stretch the glute medius, glute minimus, for the most part here. That's what we're going to do right now. Not feeling so young right now, but fell, hit his hip. His hip is not healing, so we're going to do a little bit of ART for him. This is really helpful for people that have sacroiliac pain or hip pain. Hip is actually out here, not back here. This is the sacroiliac. This is the hip. It's a form of myofascial release, or what you may know as trigger point therapy. That's another form of myofascial release. So we're going to go ahead and actively help him. So it's called ART, active release technique, meaning he is actively helping me to stretch the glute medius, glute minimus, for the most part here. That's what we're going to do right now. So go ahead, brace your hand right there. Yep. And you're going to take this leg slightly bent. You're going to kick to touch the wall. I know we don't. Let me move the table here. We don't have. See that? All right. I ate my Wheaties this morning. So go ahead and you're going to do that and touch the wall with your toes and then bring it right back. Go ahead. Good. Bring it all the way back to touch me. Yep. Good. Good. Excellent. Yeah. Good. Take a break. It's tiring, isn't it? It's not as easy as it looks. You can bend this bottom leg to brace yourself a little bit more, okay? Take a few more breaths in and out. We're going to get a little bit lower here into the trochanter where it hurts a little bit more, okay? And go ahead. Doing okay?
Yes.
Good. Is it a little painful?
It's a little painful.
Yeah. Okay. Good. Okay, now I want you to land your back. So you landed on your hip from the back side, correct? You landed on it from the side, coming from the back slightly, right?
Yes.
So, how did that adjustment go for you last time we actually adjusted your hip? Last time I saw you?
Good. Yes.
Okay. Take, if you could, the keys out of your pocket for me on the bad hip side, especially. Okay. Now I want you to cup yourself there for me. Yourself. Good. I'm actually going to slide you down just a little bit. Okay. Take the sneakers off. I want to check your ankle. Any pain when I do that?
No.
Okay, any pain there?
No, just stretching.
Just a stretch, okay. Just relax here. turn back over on your stomach. So what I did there was I adjusted your hip in the opposite line of force of the trauma that you had, right? Just like we did last time. You let me know if there are any problems. Okay, you might be a little bit sore after that adjustment. And this hip is now pulled back, so we have to correct that. Pelvis pulled back with that adjustment. Just relax here. Okay, now keep your leg straight and raise one leg as high as you can. Okay, the other one. Okay, is one leg harder to raise than the other?
No, before, no.
No? Do that again for me.
Very, very good.
The other one? Okay, you sure about that?
I don't feel much difference.
You don't, okay. This leg's not going up quite as high. I want you to cross that ankle over the left one.
This ankle?
Mm-hmm. Your sacrum's a little rotated here. Just relax yourself. Okay. Now try that for me. Okay.
Yes, I can feel now.
Now you feel it?
Yeah, I feel it takes more effort with the right.
You said more effort with the right one?
Yeah.
Cross the right one over the left. Good. Okay, uncross them. Now try that. Okay, that's going up a little bit higher. That's a little better. And the other one? Okay. How's that?
Yeah. I feel the right one going further with that.
Mm-hmm. Yeah, this one was slightly off, maybe 2 inches. Not a great deal, but the sacrum was rotated. We just corrected that. You're really locked up and fixated here through your thoracic spine, which is common for you. So we're going to go ahead and adjust that. I'm going to have you turn over on your back. Okay. Tuck your chin down. Deep breath in. And blow all the way out. Good. And another one. Deep breath in. Good. And blow out. Relax. Relax. There we go. Hands up. Okay. And your hip. Obviously you fell on this left hip. Your psoas is really tight on this side.
On what?
Psoas muscle. Spelled P-S-O-A-S.
So.
Or ilio, I-L-I-O, psoas. Ilio-psoas is another name for it, okay? But your psoas muscle's really tight. So you need to stretch this, okay? And this muscle attaches onto the inside of the leg bone, okay, where the trochanter is, where you're having some of your pain, okay?
Yeah.
So I'm going to send you some psoas stretches this afternoon. Keep an eye out on your mailbox, and we'll send you those, and I want you to get started with those, okay?
Okay.
And just take a deep breath in. Good. And blow out. This is uncomfortable. If anybody's ever had their psoas released, they would know this is pretty uncomfortable, but it's really effective for lower back pain or hip pain. And the psoas muscle is a hip flexor. Okay, so it's flexing the hip, but it's also causing your upper trunk forward and lateral flexion. So when you bend down to pick up your phone or your glasses or your keys after you get adjusted, you're going to use your psoas when you bend down. You don't want to do that. You want to bend at the knees, pick it up that way. Even if it's just something light or just a foot or so or a few inches instead of doing this, right?
Got it.
Easier said than done sometimes, but try to remember that when you're grabbing those things off of the chair there, because the chair is pretty low. Wiggle your toes for me. Okay, you're all set.